You've been an industry veteran and an expert driving innovation. I'd love to hear your AI journey and how that journey has evolved.
It's interesting to think about our AI journeys, both in regard to how we as individuals are interacting and using these tools in our day to day jobs, as well as our day to day lives, and how we're trying to experiment and keep ourselves agile and learning. And then how we see our organizations and our peers around us starting to evolve with these tools. For me, I focus my energy on clinical trials and medicine development. And, traditionally, these are, we call them risk averse and cautious areas. I think that they're areas, actually, it may be a misnomer to call them risk averse. Sometimes I think the real word is predictable. They want their operations to be predictable. And sometimes when we talk about digital and innovation, it sounds to them like interesting things that could make execution less predictable. Is that new and digital innovation thing going to disrupt my timeline, my budget, my expectations of quality? And so it is going to be interesting to continue to see how AI adoption sits on that traditional curve, because so much of AI done right can make our conduct more predictable. And so if we think beyond industry as just being risk averse and cautious and embrace that really at their core, they just want predictability, and we lean in perhaps with some of those early adopter use cases that can drive and catalyze more predictable study execution, portfolio delivery, how does AI actually help to support those goals rather than seem like threats to those goals?